Hi, this is Dr. Grace with Smile Shop Facial Aesthetics, and today I'm going to talk to you about the tear trough area. This is a little bit different. If you followed our channel, we usually do a procedural type of video where we have a before and an after, and we actually do a procedure on a live patient because I feel like that helps you see the procedure and makes you feel a little bit more at ease understanding what you're going to be going into when you come in for a procedure. But I chose to do this video in this fashion where I'm talking to you and just speaking to you on an educational level of explaining the whys behind why we do the way we do it, the why I do it the way I do it, which materials I pick, what my thought process is, and also what you can expect if you choose to do this procedure here or anywhere else. So before I get into the anatomy of the tear trough, let me first talk to you about these dermal fillers. Now, as many of you know, dermal fillers have been around the market for quite some time. But I would say over the past 5 years or so, 10 years, there have been numerous different types of fillers that have entered the market, which is a good and a bad thing. For the injector, it's a great thing. If you can get your hands on different kinds, you can see what works best for you based off of their different qualities. Some are cross-linked stronger, some are cross-linked weaker. Some are great for the mid-cheek volume, some are great for lips, some are great for a natural look. So many of these fillers have different properties. The downside though is that it takes some time to get your hands on something and for you to have enough casework and enough trials to see what works really well for you and to understand how they're all different. Now, hyaluronic acid fillers are the most common types of fillers, so that's kind of what we'll focus on today. These fillers are generally hydrophilic. What that means is that they love water. And this is a great quality, right? Like for a filler that you're trying to fill in some space, you want something that's going to use as little product as necessary to fill a void. So like when you're pouring cake batter into little muffin pans, you fill it in just like halfway, you put it in the oven, it comes back out, and all of a sudden it's way more than you thought, it expands. That's the same thing with most of the fillers, that they just drink the water and it actually expands with time. Not that drastic, but they all have that quality. So most of the time, that's what you would want to see. You know, if you want nice plump lips, even if you're trying to just make them look natural, you just want a little bit of that filler to go in there, and then it just makes a nice volume. Well, the tear trough is just a different anatomy altogether. That's usually not what we're trying to accomplish. We're not trying to make anything bigger per se. We're just trying to fill in what we see as a deficit in a two-dimensional view. So most of the time, my patients will come to me and say, you know, I've had this tear trough filled before, and sometimes there's like a little ball that's kind of still there, a little squiggly line. Sometimes there's this thing called a Tyndall effect, where it kind of leaves behind this blue-gray tint. And that's when the filler is placed a little bit more superficial than desired, and it leaves this reflection when someone else is viewing you. And then also, on some occasions, you'll get the instance of the overfill, like what I was saying when the filler expands, because not all fillers are meant for the same thing. So if you put some of that filler in there and then you overfill it, but that day it looks great when you leave, but then the next day or the day after, it looks like, you know, once it used to be sunken in and now it looks like you've been crying for days. These are all experiences that real people have had, that they're just a little bit more hesitant to try doing it again. But like I said, the benefit of, you know, fast forwarding to today's age now is that there are so many fillers on the market that have the qualities that we want to address the tear trough area dependent on the patient's anatomy. So this is the second part of it, is understanding that everybody's tear trough defect is caused by probably different factors. So the first factor is what I call a true tear trough. And what that means is that this is a genetic trait. It's probably not what you want to hear, like, hey, you were born with this, there's nothing you can do about it. That's not really true. It's just that, you know, some people pretty much have a real tear trough since they were kids, you know, late teens, early adulthood. And if you've had that dark circle, the sunken in look pretty much your entire adult life, more than likely that's just a genetic factor that has maybe been made a little bit worse with aging, but it's something that you've had forever. So that would be treated way differently than someone that has the tear trough defect due to just aging and collagen loss and gravity, okay? With the aging process, there are a lot of things that are going on. First of all, our skin loses the elastin and collagen. So just in general, our skin is going to be a little bit looser. Also, it'll sag a little bit more due to gravity and with that loss of collagen and elastin. But one thing that a lot of people don't realize is that we do lose the fat that's on our face. Right underneath the eye, right by the nose, by the alar, and underneath the zygomatic bone process is a little thin layer of fat that is gradually lost as we get older. Now, if you have what I consider a true tear trough, and I'll show you how you can test for this, more than likely, even with a little bit of fat loss, like I said before, you've always kind of had that sunken in or the circle eyes. But if you have never had that before and all of a sudden you wake up and you're like looking in the mirror and the first thing you see are these big sunken in eyes, more than likely that's just a product of the fat loss. Okay, so the one way that you can really tell is if you were to go really close and you look at your eye, and let's say if I were to go like this and push up under here, if that corrects the defect where I'm just kind of pushing up and squeezing and making sure the volume gets pushed up here, a lot of times that just indicates that it's due to fat loss. Same thing if you pull the side here and then this goes away, then that means that you don't really have a true tear trough. You have what I call, what we all call a pseudo tear trough. Now, a pseudo tear trough is just a loss of the mid-cheek area and the volume, and that's fat loss and even bone resorption in our jaws as we get older. So that's kind of like a mid-cheek filler that a lot of people are very familiar with. Now, if you have a true tear trough where, you're going like this, nothing's changing, you're going like this, nothing's changing, that means that the skin is intimately and just fused to the muscle underneath there. Okay, so there's very little fat that's actually causing that to have that sunken in appearance. So these are, again, treated very differently. And the third thing is if you just have loose skin, and that's very common, especially here where I am in Las Vegas. The sun is brutal in the summer. You could lather on your sunblock, you go outside in 2 minutes, it's already toasty. So years and years of that sun exposure, and also if you just didn't really have a great skincare regimen, you can develop a lot of dry skin here, a lot of loose skin, and then as you lose that collagen and elastin, it just gets very crepey. Now that's a whole different problem altogether, but it can make it look like you have a tear trough problem. Now in that case, that's more of a skin rejuvenation type of treatment. We could do PDO collagen thread treatment under there, microneedling with PRF, injectables with PRF, and all of those treatments are designed for your skin to regenerate itself and to grow new collagen and for your skin cells to just rejuvenate. But when it comes to actually using a dermal filler to correct the tear trough, if you have a true tear trough, and that's when I said that the skin is fused with that muscle underneath, we need to get that injection in between the skin and that muscle layer. So it's going to be a little bit more superficial than if you have a pseudo tear trough when you just have that volume loss. And with the volume loss, we're just getting underneath the whole thing right onto the bone and filling that area up. Right? When you're going to correct a mid-face deficiency with just the mid-face volume enhancement for a pseudo tear trough correction, we would use a dermal filler that's a little bit thicker. It's a little bit stronger cross-linked. And what that means is that, it can lay right on the bone and it's a little bit viscous, more viscous. So you can really mold it. And, we're trying to get it to mold into that cheek structure because there's probably a lot more volume that was actually lost. Now with a true tear trough where you're getting in between the skin and the muscle, you don't want anything that's really too firm. And that's where you get those little globs sometimes, So what we're trying to do is get in between that layer so it's a little bit more superficial, but you want to use a filler that's not as viscous, not necessarily super runny, but something that can flow in between those tissue and in between those fascial spaces so that it'll spread nice and even and just slightly elevate that area. So sometimes we have kind of a mixture of both. And I would say for myself, even when I was doing this earlier, I was just noticing, it's kind of corrected when I do this, but it's not really corrected when I do this. So that indicates to me that I have a little bit of that strong fixated attachment, like a true tear trough. And then I also have that pseudo tear trough thing going on because I I have lost a little bit of fat under here. I've had patients ask me, why do I need to pay for 2 fillers and she only needs to pay for 1 filler? Well, that really is because of your anatomy. It's not like we're trying to, make you special for not having to have 2, but sometimes, for your benefit, up in this area, I would use perhaps like a Juvederm Voluma, which is really great for mid-cheek and mid-face enhancement. But then for like in here, like I said, I would use something a little bit less viscous and a little bit less firm. So those are 2 things that you need to consider. The other thing that you would want to consider when it comes to this tear trough area is that it is really difficult for an injector to see how much to fill because everybody's skin quality is different. Again, you can have a pseudo tear trough or a true tear trough or kind of combination of both, but we always want to underfill. And that's one thing that you need to understand. What happens is that I'm done with the treatment. You look in the mirror and you're like, it's still there because like I said, it expands just a little bit and some fillers are more hydrophilic than other fillers. So, and again, if you're trying to go a little bit more superficial, you don't want something that's super hydrophilic, right? So in a few days, in a week or 2 weeks, you'll notice that that filler really fills up with water and that everything stretches out and looks really nice. But initially, it may look pretty much the same. Also, if you have a little bit of that skin laxity, sometimes we'll do some collagen therapy in addition to the filler. And it may not look very different at first, but with the collagen stimulation treatment with, PDO threads, you need repeated treatments of those for your skin to really change its quality. You really get the best bang for your buck a couple months down the line even. So sometimes, with this tear trough procedure, it could be very unsettling for some people to not see the result that they're looking for right away. It's a lot easier to add than to take away. So just keep that in mind when you go in to do a tear trough type of procedure, that it will look underfilled. And again, this area too is very vascular. There's a lot of bruising potential. So if it does bruise, then that even throws it off even more, So most injectors are a little bit more conservative when they're trying to go through that area. So that's kind of my little spiel for now. If you have any questions, please feel free to comment below. And I'll try to do more of these videos in the future. So if there's a topic that you want me to address, leave a comment and let me know. Thanks. Talk to you later.